Welcome to Tuesday's edition of COVID-19. There has been yet another subtle decline in our daily tally, but authorities remain wary as sporadic cluster infections persist. And dispute over the origin of COVID-19 looks to affect a host of regional issues. We have more later on in the program. Here first is the broader pandemic coverage with our Kwon So-ah. Now, so let's begin here in Korea then.
Sure, Sunny. We're seeing a slight drop in COVID-19 infections to 454 this Tuesday, which is around 30 cases fewer than on Monday, and that includes 435 domestic transmissions. So for 2 straight days, we are seeing the numbers in the 400s, but that can easily change as the week progresses because on Wednesdays, usually we are seeing higher figures. And that's also why the average in daily domestic transmissions is still close to 600 in the past week. And the country's accumulated caseload has now surpassed 145,000. Now, if we take a closer look by region, we are seeing over 130 cases in Seoul and Gyeonggi-do province. But it is good to see that there are more countries, more cities now with single-digit figures. However, that's not the case in some places like Gyeongsangnam-do province and Daegu. So let's take a closer look at some of the places that are worse hit than other places. New infections in the capital region emerged in various daily settings, including workplaces, schools, a distribution center, a place of worship, private gatherings, and more. Both Seoul and Gyeonggi-do province each reported over 70 person-to-person transmissions. In the central region, officials in the city of Daejeon could raise social distancing measures to level 2, with daily cases hovering between the 20s and 30s recently, in particular due to the rising number of cases linked to a cluster at a live cafe. In the southeast, Gyeongsangnam-do province's Changneong County is the only region in the province to have issued level 2 social distancing, with more than 50 cases traced to a foreign restaurant. The biggest concern in the city of Daegu is a nightlife venue-linked case involving the UK variant, with 325 patients categorized in that cluster. Meanwhile, a revision to the social distancing scheme, which is currently a 5-tier system, is expected to be announced this Friday. But with no big improvement in the recent daily number of cases, the current measures are expected to stay in effect until the end of this month, and the new revised measures will start to kick in next month in July, most likely.
Right. Well, until then, that is, vaccination efforts will continue. So what is the latest on that front?
Well, the highest ever number of daily inoculations was recorded on Monday, with close to 875,500 inoculations. And that's when you combine the people who got their first shot and their second shot yesterday. Now, over in India, the federal government is expected to take over the pandemic-hit country's vaccination program later this month, which means free inoculations for all adults. And Spain on Monday, meanwhile, has opened its border to the world to the fully vaccinated travelers, of course, and that is with the hope of reaching 70% of its tourism industry, so to 70% of the pre-pandemic level, that is. And let's take a look at the figures abroad. And here, Spain, as we just talked about, Spain has 3.7 million infections, being the country with the 11th highest number of cases in the world. And we've got Netherlands now on this graph, becoming the country with the 20th highest number of cases. And the total number of infections around the world now stands at 174.3 million. The good thing is that for the second straight day, we are seeing less than 8,000 daily fatalities. And those are the numbers I have for now. I'll be back with more after the government briefing. Back to you, Sunny.
All right, so thank you for now. Meanwhile, relevant officials on Monday disclosed a fresh set of COVID-19 safety guidelines ahead of the summer holiday here in the country. I have our Kim Jae-hee here in the studio with details on that. Welcome, Jae.
Good afternoon, Sunny.
Right, let's start with those new measures for our second summer amid the pandemic.
Right, Sunny. Government officials are encouraging businesses to allow their employees to take summer vacations across the broader time frame to prevent congestion at tourist hotspots in late July and early August.
고용부는 100인 이상 사업장의
The Labor Ministry is advising businesses with over 100 employees to extend their summer holiday period by 2 weeks, from the third week of June to end of third week of September. The government will provide incentives for companies that show exemplary practices.
Museums and art galleries will only be open to people who have booked their visits, and online reservations are also recommended for concert halls and movie theaters. No more than 4 people will be allowed to share accommodations unless you're staying with immediate family members, in which case up to 8 people will be permitted.
Right. Also on Monday, President Moon Jae-in has shared positive prospects, that is, on the goal of herd immunity here in the country.
That's right. During a meeting on Monday, President Moon said that he expects about 36 million people, which is about 70% of Korea's population, to have gotten their first doses within the third quarter, fueling this optimistic timeline. Take a listen.
백신 도입과 접종, 예약 등 모든 부분에서 계획 이상으로 순조롭게 진행되고 있다고 말씀드릴 수 있습니다. 이달 말까지 1차 접종 목표 1,300만 명을 달성하고 방미 성과인 101만 명분의 얀센 접종까지 더하면 상반기 1,400만 명 이상 접종도 가능할 것으로 기대하고 있습니다. 집단 면역 시점도 더욱 앞당겨질 것입니다.
The government also expects 1/5 of Korea's total population to be given at least 1 vaccine dose by the end of this week. And with the country adding the highest number of daily inoculations on Monday, about 16.5% of the population have now received their first shots, and around 4.5% have been fully vaccinated. On Monday, the country began administering AstraZeneca shots to those aged 60 to 64. And on the same day, military service members under the age 30 also began receiving their first Pfizer doses as well. The government is also aiming to have school teachers vaccinated during the summer as it looks to fully resume in-person classes for all schools from the second semester in September. Vaccine bookings for first and second grade teachers at elementary schools and workers at kindergartens and daycare centers kicked off on Monday for those under the age 30. Those eligible can book their appointments until mid-June through the KDCA's website or their call center by dialing 1339. And over 1 million doses of Johnson & Johnson's Janssen vaccines, which arrived in Korea last Saturday from the U.S., will be given to military-related personnel aged above 30 starting June 10th.
What is the latest on Korea's efforts to develop COVID-19 vaccines then?
Well, Sunny, 5 Korean drug makers that are developing COVID-19 vaccines have completed phase 1 clinical trials for their vaccine candidates. Some of them plan to start phase 3 trials as early as July. The government said Monday it will provide financial aid to support the development of domestic vaccines.
현재 임상 시험을 진행하고 있는
Korean vaccine developers have set a goal of starting phase 3 clinical trials as early as July. And the government plans to increase the budget for vaccine research and development.
Right, that is quite encouraging to know. All right, Jay, as always, thank you very much for the coverage.
Thank you for having me.
Right, up next, we are poised to join the regular briefing on the COVID-19 situation here in Korea for this Tuesday. And while we wait for that to commence, let's take a look now at the incentives for those who have received at least the first dose. I understand the briefing is about to start. We'll come back to you afterwards.
Let us now begin our regular briefing for June 8th, a Tuesday. First of all, as for the vaccination updates for those above the age of 60, starting from February, we have been rolling out the vaccinations here in South Korea, and the accumulated doses that have been given out surpassed 10 million. And as of today midnight, on a daily basis, we have over 875,000 daily inoculations, which is even higher than the daily highest daily inoculation that has been reported earlier in May. And we also have more than 8 8,455,000 people receiving their first dose of the COVID-19 vaccines. And as of 8th of June, as for these senior citizens above the age of 60, we have also many people receiving their vaccines, and we have found that about 42% of the eligible recipients have completed their vaccination. And as for the age group, those above the age of 80, we have over 70%, and also in their 60s, we have 31.7% of vaccination rate. And going forward, we will also continue to inoculate these senior citizens who have been already booked their vaccination process, and we believe that the vaccination rate for these citizens will surpass 80%. And as mentioned yesterday, if we are able to roll out the Pfizer and Janssen vaccines as scheduled, we will have no difficulties in achieving our goal of 13 million inoculations, about 25% of the total population, in the first half of this year. And we believe that this will further contribute to decreasing our fatality rate, as well as those who have critical ill symptoms. And once again, we will be also going out badges and stickers as for those who haven't been fully inoculated. And we believe that these badges are to provide some respect to those who have been inoculated, and this will not serve as an official certification of the vaccination itself. And we have been providing the draft of these badge designs, and going forward, we will also distribute these details through the local community centers. And if you are vaccinated, you will also be able to get either online certificates and also either an online or an hard copy of these documents. And if you would like to get a sticker, you can visit the local community center, and after getting your ID check, you could also get the stickers and you could attach it on your ID card. And as for this sticker, you need to also confirm the name and also your date of birth, and also your inoculation dose and the day of inoculation. So these will be entailed in this sticker. And as for this sticker itself, as for the campaign and also further guidelines on its use, they will be issued out starting from the late June. And as for the vaccine supplies, we have some details as well. And as for the supply of vaccines, we have Pfizer vaccines, which are due to arrive on the 9th of June, and we have about 650,000 more doses to arrive here in South Korea. And as for the Pfizer vaccines, this will make about 5.5 million doses among the 7 million doses that are set to arrive within the first half of this year to be fully arrived in South Korea. And we also have our weekly analysis on our adverse responses after inoculation. And compared to the total rates of inoculation, we have about 0.35% of these adverse responses reports. And most of these cases, amounting to about 94%, are common and mild symptoms like headache and muscle pain. And the rest of the 5.5% are death or severe cases, including anaphylaxis reactions. And we have more women reporting these adverse responses, and also the report rate was lowest among those over the age of 75. And as for the AstraZeneca vaccines, we have 0.49%, and Pfizer vaccine 0.2% report rate. And also, as for the details of the deaths after these inoculations, we have about 208, and 72 had the AstraZeneca vaccines, and the rest had Pfizer vaccines. And as for the Pfizer vaccine recipients, we have more people reporting the death, and this is because most of these eligible recipients were senior age group over the age of 75, and also residents in the nursing homes and nursing care centers. And going forward, we are also witnessing a continued decline in the number of these adverse responses reports. And as for the Pfizer vaccines, we had higher report among the second dose recipients. And in also AstraZeneca vaccines, on the other hand, we had relatively lower reports after the second dose inoculation. And we had higher report rates among the younger generation in general. And this is also a message to the general public. So in order to prepare for any adverse responses after inoculation, you need to stay at the vaccination center for about 15 minutes after inoculation to monitor your symptoms, and even after returning home for the next 3 hours or so, you need to closely watch your conditions. And you need to keep the injected area clean, and you need to also look at your conditions in detail for the next 3 days. If you have high fever or if you have any adverse responses, please visit a doctor as soon as possible. And after COVID-19 inoculation, if you have pain in the injected area, if you have rashes or swollenness, or if you have fatigue, muscle pain, and headache, and nausea, or other symptoms, these may occur. However, most of these symptoms should fade out after 2 to 3 days. And as for the pain in the injected area, please use a cold towel or cloth to put it over the injected area. And if you have any muscle pain or a fever, please take painkillers as well. This may help. And as for the common symptoms, if they get severe, hampering your daily routines, and if they develop into severe allergic reactions like rashes all over your body, you need to visit a doctor as soon as possible for detailed consultation. And if you have severe allergic reactions, you need to either call our call center or visit a close ER. And also, as for the low platelets, blood clots, you need to also get doctor's appointment as soon as possible. And these doctors who have been monitoring these patients need to report to us as soon as possible. And as for these rare blood clots, they may recur. They may lead to breathing difficulties or stomach ache or chest pains, or also swelling of the legs after 4 days. And even after inoculation, if you have a very severe headache that lasts over 2 days, or if you have severe pain, and if you have also swollenness or bruises in other areas aside from the injected area, you need to also consult with a doctor. And for the second round of the compensation committee, we have had detailed discussions, and we have been looking at the 170 cases, and they have been concluded to receive the benefits, including the treatment costs. And also starting from June, we will also have 2 rounds of these meetings each month, so that we would be able to provide these benefits and money as soon as possible for those who need treatment costs. And going forward, we will also provide emergency aid as for the need of treatment, and we will also make sure that there are no loopholes going forward. And next, as for the compensation committee, we also have some details. Up until now, we have had 15 rounds of related meetings so far. And up until now, they have been looking at death and severe cases, about 470 cases, and anaphylaxis cases, about 180 cases have been reported, have been reviewed so far. And as for the death, we had no cases that have been linked with the correlation of the vaccines. And as for the severe cases, we have also had 3 cases that have been deemed to have correlation, and about 3 cases of anaphylaxis have had the correlation with the COVID-19 vaccine. And especially in the 15th round of this meeting, we looked at 34 deaths and about also 40 severe cases as well. And as for 33 new deaths that have been reported, the average age was about 79, and all of them had underlying illnesses, and they were recipients of 29 were recipients of Pfizer, and 4 had the AstraZeneca vaccines. And as for the 31 cases of these deaths, we have deemed it is difficult for us to see a close correlation with the vaccine, and most of these cases were due to myocardial infraction and also other related issues like strokes and so forth. And also they had the underlying illnesses like high blood pressure, and we believe that these have been made severe due to their high age as well. And however, we have 2 pending cases, and we will be also undergo autopsy, and they will also have another round of review after the autopsy. And as for the 29 cases of the severe cases, most of them were also seniors, and about 26 people had underlying illnesses, and they had about average of 4.5 days until they developed the symptoms. And also Pfizer vaccine recipients were 24, and 5 got their AstraZeneca vaccine. And we have seen that there have been a comprehensive review, and 28 cases have seen that there have been no correlation with the COVID-19 vaccine. However, one case, we see that after inoculation, this person has went to severe cases of headaches, and also this person also went through low blood platelets and also blood clots, and we have been confirmed with the correlation with the vaccination. And as for 9 out of the 13 cases of anaphylaxis, we have also deemed to have the correlation with the COVID-19 vaccine. And as for the cluster infections that have been reported lately at restaurants and also related multi-use facilities, we have some details. And starting from January, we have 59 cases, and more than also 500 people were infected so far, and they have been also on a rise after April. And in Hanam City, we have also a restaurant that was under inspection, and one of the patron, he or she had the virus and spread the virus to 18 other users, and also about 2 workers there, infecting about 24 of people. And related to this case, the KDCA says that we have been looking at the risk analysis together with Korea's construction association, and we have done a simulation of the travel of blood of the respiratory droplets, that is, and the results show that in the main entrance, when the main entrance is opened, and compared to that, if we have both of the entrances opened, we decrease the amount of the time needed to flow the respiratory droplets by about 15 minutes. So these opening up the doors for detailed ventilation is the most easiest and effective ways to decrease the risks of infection. So if you are workers at these facilities, please open all of the entrances so that you could have natural flow of air. And at restaurants and also at multi-use facilities that have kitchens, we ask you to also have the ventilation at the cooking counters as well. And if you have any clinical symptoms of COVID-19, you should refrain from going to these multi-use facilities, and always keep social distancing measures and wear your face mask at all times. And next, as for the new variants, we have also updates. And the bolstering of the new variants are also carried out through more analysis here in South Korea. And we have been looking at about 14% of these cases. And this is higher, about threefolds than the average of 5% that is conducted in other countries. And for the past week, we have been looking at 583 confirmed cases, and we have seen that 175 cases of new variants have been conducted, and about 30% of these cases have been reported, and this is quite similar to the previous weeks as well. And after the October of last year, we have been looking at over 10,000 cases, and we have confirmed 1,730 cases of the new variants. And among the 175 cases, we have been looking at the Alpha variant, 154, and the Beta 4 and Delta, the Indian variant, have been reported to stand at 17. And among them, 15 are imported cases, while 160 were local transmissions. And as for these reports, in Gyeonggi-do province, we had 35 cases, Gyeongnam 20 cases, Chungbuk 16 cases have been reported in these regions respectively. And as for the new variant cluster infections, we had a total of 14 new cluster infections, and all of them had the Alpha variant, which is the UK variant. And also we have seen a total of 186 infections have been occurred, and by an average of 13 infections per cluster have been reported so far. And since May, we have been receiving the flights from India. We have also had 16 related flights, and in this process, 71 people have been confirmed with the Delta Indian variant. So all of these 71 people have been infected with the Delta variant. And in looking at the countries, other countries, as for the countries that have been rolling out the vaccines, they are seeing a stagnant rise in the daily tally. And here in South Korea as well, we are also keeping our vaccination rate is also keeping up speed. And for the time being, we believe that it is very important, and we need to also urge the public to take particular precautions. And this is because even after inoculation, you need to also have at least a certain period of time to pass until you have antibodies developed. And also, we have the social protection rate, which is also known as the herd immunity. This will also take some time for us to achieve this as well. And once again, we highlight that we need to combine the effects of the vaccination and the social distancing measures and other quarantine measures in order to keep our society safe from the COVID-19 infections. You need to wear your face mask at all times. You need to ventilate your space, and also immediate test is also very important as well. And the quarantine authorities will also exert our full efforts to carry out our inoculations safely as well.
네, 지금부터 기자님들 질문에 답변 드리겠습니다. 방역과 바이러스 관련된 질문.
Right, there was Lee Sang-won with Tuesday's afternoon briefing. So he spoke at length over several issues.
Yes, quite a lot of announcements he made. First off, there are high expectations on the vaccination front, with Lee mentioning that the goal of 13 million people to be vaccinated, or 25% of the nation's population, that's expected to be reached. And also as part of vaccination incentives, he said that vaccinated people are expected to receive badges or stickers, but that's more of a sign of encouragement and thankfulness, because it's not going to be an official vaccination verification certificate. And also he had some comments on recent infections linked to restaurants. With the beginning, there were recently 52 cases linked to restaurants and more than 900 individual infections. So there has been made an analysis regarding those restaurants, and the gist was that that poor ventilation has in many cases led to cluster infections at such places. And last but not least, some updates on varying cases here in the country. A total of 175 variants were detected in the past week. So with that, the country has over 1,780 variant cases. And in the past week, 160 of those were domestic transmissions and 15 were imported cases.
I see. All right, so thank you very much for that.
My pleasure.
We should continue with the investigation and go to the next phase of the investigation that the WHO has done. So because we don't know 100% what the origin is,
这是对科学的不尊重，对人民生命的不负责，更是对全球团结抗疫努力的破坏。
Our economy is recovering from the pandemic, but we still have a long road ahead of us.
双方认为，发展双边贸易非常重要，并就彼此关心的问题交换了意见。
The pandemic has fueled a fresh feud between China and the US as the latter questions the origin of COVID-19, calling for transparency from the former. Now, for more on the implications of this dispute, I have Professor Kim Hyun-wook from the Korea National Diplomatic Academy. Welcome back, Professor Kim.
Thank you.
And I also have Professor Oh Jun-seok from Sookmyung Women's University. Pleasure to have you back, Professor.
Thank you for having me.
Right, Professor Kim, what do you suppose are the Biden administration's intentions as it vows to get to the bottom of the origin of COVID-19?
Well, I think, generally, the Biden government's posture toward China is very hawkish right now. Maybe some experts have expected that the Biden will try to be more focused on a relationship with China, but I think more part of the Biden's China policy resembles Trump's rather than Obama's. So I think generally it's hawkish. And secondly, maybe strategically, it aims to use the coronavirus origin discourse for a future bilateral trade talk with China. I think Professor Oh will be talking more about that. But I think during the Trump government, Trump focused on the lessening the trade surplus of trade deficit of the United States vis-a-vis China, and corona issues and other issues he used to blame China, which I think was a very important leverage for Trump. So I think Biden can use these issues to deal with China on trade issues, I think.
Would it be reasonable then to assume that confrontations between Beijing and Washington will escalate in days to come then?
Yes, I think so. But how much, to what level is the key? I think unlike a Trump government, Biden, I think, will try to manage the relationship rather than break it down to nothing, because he knows that China's Communist Party collapse is not easy. The Chinese role in the world is important. So I think even though Biden wants to be ahead of China in many strategic aspects, I think, and also very hawkish to China, I think, Biden's policy toward China is not confrontation, I think, rather it's a competition.
Right. And on an optimistic note, though, Professor Oh, trade talks between China and Washington appear to have resumed. What are your prospects on bilateral economic efforts?
There is an iron rule that as far as the trade war is concerned, that more pain than gain. So it is right time to talk about and then trade approaches and punitive tariff should be hashed out. So in this sense, economy-wise, no war is the best bet. But ongoing trade war is so costly and it should be addressed now. As we already know that when the pandemic hit, that the trade war faded into the background, used only to highlight the Chinese inability to meet the condition of the deal to purchase an additional $200 billion worth of American product over the 2017 level through 2021 due to the disruption from the pandemic. I just briefly commented three things as an agenda. First, Biden administration has expressed a wish to discuss U.S.-China trade issues with its allies first. That President Biden says the best China strategy is to get all their traditional U.S. allies in Asia and in Europe on the same page. And second one is ESG, environmental, social, and corporate governance became prominent and then multi-dimension during Biden presidency. U.S. Customs has blocked the imports from Xinjiang Production and Construction Corporation over alleged forced labor. Something like environmental regulation or pollution protection could be a blocker in the international trade. Third one is China's technology regime is viewed as a techno-authoritarian, which is incompatible within the market mechanism. So in this end, the United States prepare a review and legislation that will ultimately strive to bring chip manufacturers back home, so-called reshoring, and to make investment more in technology.
Having said that, Professor, what are some of the most urgent issues that need to be tackled for these two countries to perhaps advance their trade ties then?
Might be summarized into three. One is the additional tariff negotiation, and second one is export restriction, and third one is the most important, is about the restructuring supply chain. US and China imposed additional tariff on goods imported from the other country, which means that buyers in the opposing country need to pay higher import taxes to bring their purchase into the country. At the end of 2009, the United States imposed tariff on more than $360 billion worth of Chinese goods, while China has retaliated with import duties of their own worth around $110 billion worth on US product. Second one is export restriction. We already know that export restriction lead to a kind of broad scale of decoupling of the Chinese and American technology. But we have to consider it could also erode innovation and competitiveness as well. So-called Clean Network Initiative used the trust country of origin requirement to insulate the US from Chinese technology, which pressing the American allies to exclude Chinese equipment from their 5G telecommunication network. Third one is the most important. Biden signed an executive order to analyze the global supply chain in 4 industries strongly affected by the pandemic. These include computer chips, large capacity electric vehicle batteries, pharmaceuticals, and critical mineral in electronics. The semiconductor industry faced a serious bottleneck at the outset of the global pandemic when Chinese factories were in lockdown. So these industries were also hit by the US-China trade war. It is likely that Washington wished to secure its supply chain to reduce reliance on China and to increase competitiveness with China in the manufacturing of goods like semiconductor and so on. Until the trade war is resolved, losses from high cost will continue to mount.
I see. And I'll ask you more about that review by the Biden administration. But first then, on the diplomatic front, meanwhile, Professor Kim, do you see the Biden administration's offering of vaccines to Taiwan as perhaps aggravating animosity between Beijing and Washington?
Sure. The China issue, Taiwan issue is an important core for China. U.S. and China has maintained the one China policy ever since it normalized its relationship in 1979. And of course, there were several, U.S. high-level officials visit to Taiwan, and also by Taiwan Act, Relations Act, that the U.S. Continuously provided assurances, security assurances to Taiwan, but never mentioned that it is breaking the one China policy historically. But I think, Biden government is not saying that it is adhering to one China policy at all. Maybe also it's not saying that it's breaking the one China policy either. So we don't know what is the policy direction of Biden government's Taiwan policies. Before it inaugurated, the Taiwan, the Biden camp experts told me that it will still adhere to the one China policy, but after its inauguration, I think Biden's government's postures are a little bit changing now. So I think this is very important issue between U.S. and China. The Indo-Pacific Com said that maybe in 7 years, possibility is high that China will use its military force to invade Taiwan. So I think Taiwan issue is very important for the United States and China altogether, and also Japan, because Japan thinks that Taiwan issues is important because it has some direct effect on the Senkaku issues. It's important security area for Japan. So I think this will be a core issue for China. Will definitely make two countries to be confronting each other.
Right. Also, in a separate move, Professor, President Joe Biden has expanded the U.S. ban on investments in Chinese firms to include a total of 59 companies. What are your thoughts on this latest move by the Biden administration?
We have to think about from the past. Obama administration raised the issue of massive trade imbalance and China's currency manipulation and other unfair practices. And after that, Trump promised to reduce the trade deficit with China, which he claimed in large part on unfair practices, including intellectual property theft, forced technology transfer, lack of market access for American companies in China. Biden view a trade deal with China exactly the same, cumulatively in line with the Obama administration and Trump administration. With U.S. and China tariffs still in place and phase 2 negotiation on hold, it is very unclear how long the trade war will last. I suppose even though the approaches of trade policy might be less harshy than before, but similarly likely rational and multilateral minded, but there is virtually no chance of Biden giving China a softer deal. Biden administration keep poking eyes of trade issues when unleveling the playing field caused by the Beijing subsidiary for favored Chinese companies, and they also raise the issue of the currency manipulation ever after.
Professor Kim, meanwhile, Seoul and Washington have agreed to boost collaboration on public health. How do you see Beijing responding to this latest agreement between Seoul and Washington?
I think the more keen issue has been the Taiwan issues in the summit. The stability and peace in the Taiwan, I think it was Taiwan Strait, was the issue that China really didn't like it. They say that it's something that violates the sovereignty issues of China. So I think other issues, vaccine cooperation, collaboration, and other technology collaborations and things like that might be something that China doesn't like either. But I think now, we experience that Chinese economic coercion on South Korea after THAAD deployment, which I think was such a big fear for South Korea, and maybe that's why South Korean diplomacy has been pretty much constrained afterwards. But I think this also has been a constraint to Chinese diplomacy, because this has also made two countries' relations really worse. And some precursor is that if this kind of thing happens again, the two countries' relationship will be getting worsened and never be able to be, revert back to normal. So I think that, China needs South Korea as partner to deal with the United States. And also, China already said the red line is military cooperation. So other issue cooperation and collaboration with the United States, even though China doesn't like it, would not be such big matter and not the one that China would need to, pose economic coercion on South Korea. After which I think the outcome will be much more disastrous for China than expected.
Right. Let's now briefly touch upon, Professor Oh, the review by the Biden administration of U.S. supply chains that you mentioned earlier. What are the implications of this review for China and to a lesser extent to Korea?
Pushing to shore of U.S. supply chain is a sign of support for American industry, and it might be considered as a smart way to enhance the country's emergency preparedness, but the president should also repair create the highways of global trade before. Partly at helping U.S. companies cope with the global shortage of semiconductor chips, and then Biden's recent executive order to review supply chain vulnerability, look at key industrial sectors of economy, such as health and energy, in order to reduce the U.S. dependency on foreign suppliers and ensure that America will come up short in a crisis. But we have to think about Korea. That China has been a favorite destination for a memory chip production line as a result of the country's relatively low property prices and the labor cost. For both Samsung Electronics and SK Hynix, China is the only country outside of Korea to house their memory chip plants. Their plans for investment in China now hinge on the U.S. moves, which means that the Biden administration could mount a more extensive campaign to curb export on a wide range of technologies. Samsung Electronics and SK Hynix are likely to have no other choice but to limit their exposure to China. Korean chip makers are broadly aligning themselves with the direction set by the U.S. government.
Right. Professor Kim, the G7 summit is poised to kick off this coming Friday over in the UK. What issues do you expect to be on the agenda?
I think One Belt One Road, Belt and Road initiative by China, I think, has been important tool for China to expand its influence globally. Many countries, for example, South Asia and some part of Middle America and Africa, those countries has been the beneficiary of Chinese monetary infra building issues. Of course, many of them has been, entrapped for a lot of debt to be paid back to China. So I think, important agenda in G7 meeting, I think, will be how to cope with these kinds of Chinese Belt and Road initiative, to be more active in counterbalance against the Chinese Belt and Road initiative, to provide more infra building and economic aid to developing countries in a more sound and affluent ways. There have been also, measures and enactment in Trump government to deal with these kinds of Belt and Road initiative, but was not enough. Not enough budget was posted. So I think, globally more at G7 meeting, gathering together by many democratic states to cope with G7, to cope with the Belt and Road initiative, I think will be very, convincing and powerful than the U.S. Measures only before.
Right. All right, Professor Kim, as always, thank you very much for your words. And Professor Oh, thank you very much for your insights today.
My pleasure.
Thank you.
Right, that brings us to the end of this edition. Do seek to limit your risk of COVID-19 infection by abiding by social distancing measures. Thank you for watching.